Hello everyone, this is Cam from Pulse Cardiac Health. And in this video I'm going to be talking about depression and anxiety and how they relate to cardiovascular disease. I'm going to start by saying that it's very normal to feel sad, to feel blue, to feel angry, to feel worthless once in a while as we progress through our lives. And those are called depressive symptoms. When these symptoms persist and get to the point that they can actually impact our daily lives, so they may impact our ability to get to work or how we interact with our family or our relationships, that can be called clinical depression. Anxiety is very similar. It is normal to be anxious once in a while. If you're going to speak at a public event, it's normal to be a bit anxious. But anxiety disorder happens when your fear and your anxiety get to the point that they're impacting how you live your life. So that's an anxiety disorder. Now, normally in our population, about 3 to 5% of people have depression/anxiety. And I say them together because generally, if you have depression, about 70% of the time you also have anxiety. So if I just say depression from this point on, I'm kind of referring to them both sort of as a cluster. Now, after a heart event, so a heart attack or heart surgery, that rate of 3 to 5% of the general population skyrockets, and it goes to about 15 to 30% of people that have had some sort of heart event have depression and anxiety, or anxiety. And so that's quite a step. And it has been shown that females have about twice as high a rate of depression than men do. These symptoms also can persist for quite a while. It's not just in the 3 days that you're in hospital. There's high rates of depression, up 25%, all the way to a year and beyond your heart event. So it's quite common. And I think it's quite common because you've just had an insult to your body. And it makes you do a lot of thinking. You're like, I thought I was healthy, and all of a sudden you have this event and you wonder, well, maybe I'm not as invincible as I thought I was. And then you may end up with other concerns, like maybe you don't work for a while and so you have some financial concerns, and then you're worried about your relationships and how your spouse views you and all kinds of things. So it is quite normal to have some of these depression and anxiety symptoms. It's very important to understand that if you are having depression or anxiety symptoms that are impacting your everyday life, you need to seek help. It's very important. And probably a good first place to go is to your family doctor. And there's sort of a few different treatments that they can look at. Number one, they can look at medical treatment. There are antidepressant or anti-anxiety medications that they can look at to see if they're going to work for you or appropriate for you. They also can look at psychotherapy. Now, it sounds like a bad word, but it's basically counseling and therapy to help you with stress management or relationship management or anger management or whatever your specific issues are. And that's okay. Now, sometimes you can even have direct access to counselors or therapists through some sort of insurance plan or whatever, and by all means explore those routes. But it's very important that if you're having symptoms that are impacting your life, to seek out help. Okay? Now, I am going to talk a little bit more about depression, anxiety, and how they relate to your heart. So, we know that if you have depression, you're at a higher risk of having heart events, of cardiovascular events, heart attacks and surgeries and all different things. And that can happen two different ways. Number one, it can directly impact. So when you're depressed, chemical, hormonal changes impact our physical bodies and how we work. And so we're at higher risk of having blood clots. We have increased inflammation in our blood vessels and around our body. And so we are at higher risk of having heart events or cardiovascular events. Also, it can work indirectly. So if you are depressed or anxious, people tend to sometimes choose unhealthy behaviors or less healthy behaviors. They may smoke, drink alcohol, do other drugs, and those things put us at higher risk of having heart events like heart attacks or angina. We also may not eat very healthy. We may be quite sedentary. We also probably don't sleep well. And so we may start to look at gaining weight, which can put us at increased risk of heart problems, which also can put us at extra weight can also put us at increased risk of diabetes, which can in turn put us at increased risk for heart disease. So all of these factors work together to increase our cardiovascular risk, both directly from the chemical changes in our body and indirectly through some of the behaviors that we choose that can increase our risks through other mechanisms. So it's a tough cycle to break, but I have some good news. There's one other therapy that can go along with counseling and possibly medications that can be quite effective in helping to break that cycle, and that's exercise. So we've been talking to you about exercise lots throughout this program, and we've also been talking about what are these recommended guidelines for improving our health and lowering our risk of heart disease. And we talk about doing aerobic or cardiovascular exercise 3 to 5 times a week, 30 to 60 minutes, trying to get a total of 150 minutes of moderate intensity activity per week. And that can improve our blood pressure, that can lower our bad cholesterol, raise our good cholesterol, all of these good things for us, help us manage our blood sugars. Now that definitely can impact our feelings of depression and anxiety as well. But I have good news. They have shown through research that the key to decreasing depressive symptoms is to get out and do something more frequently. So 4, 5, 6, almost every day of the week. And the more often we do it, the better off we are. But you don't have to go and do moderate intensity activity for 30 to 60 minutes. Even 10 minutes a day, if you're doing that almost every day of the week, can really lower our depressive symptoms. And it's been shown that even if you do work harder or work longer, you won't necessarily get more benefit as far as your depression. Having said that, it is better to, for your hearts itself and our other risk factors, to get that 150 minutes of moderate activity. But if we're doing 3 days a week for 45 minutes, maybe those other 4 days of the week we get out and do a walk in the morning, 10-minute walk. And if we can even do another 10-minute walk in the evening, even better if you can get out into nature. Those types of activities really help break that cycle and not only improve our heart health, but can definitely reduce depressive symptoms. So we always say, move, no matter what. Moving is good for you. And if you're not getting out and doing your whole big workouts, don't do nothing. Get up and move a little bit, because it can make a difference in your health directly, but also really, really help with those depressive symptoms and breaking that cycle. So I just wanted to make sure that you understood that exercise is a good thing. Now I want to summarize. And just remember, depression and anxiety are absolutely normal after you've had a heart event. They happen at higher rates. If they are impacting your everyday life, if they are impacting your ability to get to work, your relationships, your family, all of those things, you need to get help. Go to see your doctor. They may look at medications, and it's okay. If they're helping you, great. It's okay to see a counselor. It's not like you're failing or you're weak. It's okay. That can help you. Exercise, absolutely added into the mix. Try and break that cycle. Be active. It has good impact on our depression and anxiety, but also has other health impacts as well. So I hope you found this talk helpful. I will be looking forward to talking to you again. Thank you.